So you may have heard the news. Church Health is moving to Crosstown Concourse in January 2017. Exciting, huh? We think so too. Maybe you've had a question, or two, or 72. What will it look like? What'll be different? What'll be the same? Well, you're not the only ones with questions. We've had a few ourselves. I mean, we're about to move all of our services under one roof for the very first time. Our clinics, our kitchen, our administrative areas, they're all going to be together. How's that going to work? Will food fights break out? Will we sing Kumbaya every day? Then there's the bigger question of Crosstown Concourse, one of the most ambitious projects in Memphis history. It'll be the opportunity to build a whole new vertical community of organizations, businesses, and people who are better together. We can visualize our role in this grand, glorious design, but we've often wondered if our vision coincides with our neighbors' visions. But probably the most basic question you've asked, and rest assured we've asked it too, is this: why move? Why now? It's a pretty simple question, but it's important. It begs us to go back to the basics and remember that there's an amazing reason why we're about to undertake the biggest project in church health history. We're moving because over the past 29 years, we've learned about the not-so-obvious things that determine whether people can live their healthiest lives. We've learned that access to education is just as important to health as access to a doctor. We've learned that many people don't live close to fresh, healthy food, and that makes it hard to get to. We've learned that you can prescribe people medication for their stress, but if they're living in a violent, stressful environment, those pills are just Band-Aids. We've learned these things and so much more about the social aspects that affect people's health, and we've come to one conclusion. It's time for us to do more. Imagine one of our patients feeling welcomed, not only by our compassionate staff, but by the artists and teachers who work and live in the building. Imagine offering the people we serve an opportunity to further their education and get a better job by connecting them to one of our educational partners in the building. Imagine a little girl getting super excited to make a new, delicious recipe after going to one of our cooking classes, and then walking downstairs with her mom to the market and buying everything she needs to make that recipe for dinner that night. Now stop imagining it. This is the stuff that's going to happen once we get to Crosstown. The chronic problems we see every day that stem from poverty, education inequality, economic instability, and living in unsafe, underserved neighborhoods. Those are the problems Crosstown Concourse is engineered to solve. The partners and residents at Crosstown, yes, there will be doctors, artists, and teachers living in the building, will combine collaboration with compassion to improve life in Memphis. It's pretty cool, isn't it? Crosstown Concourse is so much more than just a new building for church health. It's a way for us to serve more people and serve them better. It's us putting our hand on the pile to build a better Memphis. Join us.